Okay, so today we're going to be talking about three-dimensional digital imaging. And this is on chapter 26 of your dental radiography textbook. As always, we'll go over some learning objectives. And number one is going to be to define the key terms associated with three-dimensional digital imaging. Also describe the fundamentals and the training, as well as the equipment used in three-dimensional digital imaging. We'll also discuss the common uses, as well as detail the equipment and patient preparation necessary before exposure to X radiation using three-dimensional digital imaging, and to identify the advantages and disadvantages of this type of imaging. So all of the images discussed in the previous chapters of this text have been two-dimensional, and dental imaging is no longer limited to two dimensions. Three-dimensional imaging is now available. In 1999, a technology called cone beam computerized tomography, or CBCT, was introduced that allows for the viewing of structures in the oral maxillofacial complex, or the jaw area, in three dimensions. And the purpose of this chapter is to discuss the basic concepts, indications for use, the training needed, as well as the equipment, and the advantages and disadvantages of three-dimensional digital imaging. So this process is a newer technology. It's only been around for about 20 years or so. And it's also a very expensive investment for the dental office. So it's not seen in a lot of dental offices unless you happen to land a job in some type of specialty like orthodontics or oral maxillofacial surgery. Some of the terminology that we'll be going over includes cone beam computerized tomography, or CBCT, CBVT, which is cone beam volume tomography, something called DICOM data. We'll get to know what the field of vision, or FOV, is. Also what a multiplanar reconstruction, or MPR, image is. And we'll learn the different planes, starting with an axial plane, a coronal plane, a sagittal plane, and different resolutions such as contrast and spatial resolutions. Also three-dimensional digital imaging and what that is exactly, and a three-dimensional volume rendering. Okay, so for years, three-dimensional imaging was primarily used in medicine. Today, manufacturers of CBCT units have developed three-dimensional imaging specifically to evaluate the oral and maxillofacial areas. The CBT is so named because it uses a cone-shaped X-ray beam to acquire three-dimensional information. The source of radiation in CBT machines rotates around the head of the patient, just like in a panoramic X-ray. And with CBCT imaging, the region of interest of the patient anatomy is called a field of view. DICOM images are imported into the viewing software that allow the dental practitioner to see the FOV, or field of view, in three dimensions. Once the images are imported, the data is viewed in three planes. So we'll have the axial plane, the coronal plane, and the sagittal plane. And when viewed together, these images are referred to as a multiplanar reconstructed image, or an MRP. An MPR. So one of the advantages of using DICOM data is that images can be shared among dental professionals, such as imaging centers and other referring physicians. And we can see here what those planes look like, or what they're referring to. So this axial plane here, it kind of cuts the patient's skull in half horizontally. And this is a horizontal plane that divides the anatomical features within the field of view into a superior, which is the top part, and inferior slices. So it sort of slices this area horizontally. So you have a top or inferior part, and then a lower or a top or superior part, and then a lower or inferior part. Okay, and what that looks like on an image is the following. So here we have an axial image, and this is if we were to cut that. Remember that axial plane cuts the skull in half horizontally. So if we were to cut the skull in half and then look down that patient's, so down like a bird's eye view down, we would see an image that looks sort of like this. And here we can see the patient's nose. This looks like the sinus cavities. And here we have the septum here, the nasal septum. So that's what an axial image looks like from an image of that axial plane. Okay, and then the coronal image, it's a vertical plane that divides the anatomical features within that field of view into anterior and posterior slices. So that coronal plane slices down vertically such that you have a front part and then the rear part of those two slices. And if we were to cut that skull in half in the coronal plane, we would get an image that looks something like this. So that plane is being sliced right down. And so it looks like, this looks like from the back, looking from the back towards the front of the patient. And here we can see the lower molars here, the upper molars, the right side of the lower molars, and then the right side of the upper molars. We can see the brain stem, or actually these look like sinuses here. And then the eye cavities here. So that's our coronal image that is taken from our coronal plane. Okay, the last plane that we're going to be talking about is this sagittal plane. So it's almost like the coronal plane in such that it's vertical, and so it cuts the skull down vertically, but instead of going from side to side or from front to back, it's going side to side. So it cuts right down the middle here, such that you have a left side and the right side of the patient's face. And what that looks like in an image is the following. So we'll cut down right down the middle here. And if we can see on the inside, it looks like that, sort of like a profile picture of that patient. So here we can see the upper jaw. We can see here's the anterior teeth here, and then the upper jaw, and then the lower anterior teeth here, kind of occluding together. So we see the patient's spine, the nose, and then some sinus cavities here in this area here. So that is a sagittal image cut from the sagittal plane, this area here. Okay, so moving on here. So most dentists who use the CBCT imaging techniques do not have formal training that is required to interpret the data on anatomical areas beyond the maxilla and the mandible. So it's not that they can't view this or they don't know how, it's that the scope of practice doesn't allow them to view beyond that maxillofacial complex. So the American Academy of Oral and Maxillofacial Radiology recommends that the CBCT images be interpreted only by a board-certified oral and maxillofacial radiologist or by a dentist that has adequate training and or experience. And the Intersocietal Accreditation Commission, or the IAC, is a nonprofit organization that has developed standards applicable to minimal requirements for optimum patient care when using dental computed tomography or radiation. So, to receive accreditation from this organization, a dentist must satisfactorily pass peer review processes and other requirements outlined by the IAC. The use of specialized equipment is necessary for these three-dimensional digital imaging. The essential components for this type of imaging system include a CBCT machine, a computer, and a viewing software. And the CBCT machines is sort of comparable in size to a panoramic machine. They almost look the same, in fact. And a patient can sit, stand, or is placed in a supine position or a laying down position, depending on the model that's being used. And in one rotation, the radiation and receptor capture the field of view, or FOV. Okay, and then the computer accepts raw data and converts them into a stack of axial images. And then the technique is completed during the data reconstruction process. And then that whole reconstructed data is then sent to viewing software. And that viewing software allows the dental practitioner to view axial, coronal, and sagittal images, or they can view the whole thing together, which is called that multiplanar reconstructed image. Some common uses for this type of imaging are the following. So CBT imaging applications greatly improve interpretations, diagnosis, and the treatment planning in some aspects of dental care. And some other common uses for this type of imaging include implant placement, extraction or exposure of impacted teeth, definition of anatomic structures, endodontic assessment, airway and sinus analysis, evaluation of the TMJ disorders, orthodontic evaluation, evaluation of lesions and abnormalities, and trauma evaluation. Well, comprehensive examinations and interpretations should be completed and documented with the overall health of the patient in mind. So it is critical to review the manufacturer's provided instruction booklet for information concerning the operation of the system. So as far as step-by-step procedures go, we need to make sure that we're consulting the manufacturer's booklet, just because every machine is different, and patient preparation, equipment preparation, and exposure are going to be slightly different for every model. So depending on the manufacturer guidelines, patient may be asked to sit, they can stand, or they can be placed in a supine position. So patients should be asked to sit or stand or be placed in the supine position, again, depending on the type of model that you have. And then you'll instruct the patient to remove jewelry, eyeglasses, any removable dental appliances, or anything else that's especially metal in the patient's face or mouth area. Also, a guide may be placed in the patient's mouth during the scanning process, just because some specialists might ask that the upper and lower teeth be kept apart. So that guide is designed to sort of do that. And they'll do that in the correct measurements that the machine requires them to. So as with all imaging procedures, the patient is instructed to remain very still during the exposure of the three-dimensional image. And as mentioned earlier, scan times vary from 7 to 30 seconds. Ergonomic head and chin supports have been designed for improved patient comfort. And some manufacturers may install laser lights to help with proper alignment of clinical structures and to ensure correct anatomical positioning. As with most extraoral imaging procedures, patients have an open and comfortable view of the surrounding area. So some of the advantages of three-dimensional digital imaging is that compared with traditional medical CT scans, CBCT imaging involves a lot lower radiation dose to the patient. Also, it has a brief scanning time. Just like with some machines, cone beam data can be acquired with a quick 8 to 10 second scan. So this short exposure time decreases the chance for any motion artifacts to occur and encourages a high level of patient cooperation. Also, anatomically accurate images is another advantage, just because that CBCT eliminates the superimposition of structures, so that sometimes when we see a two-dimensional X-ray, for example, two images can be superimposed so that you're not sure if that image is on the back or the front or sometimes on the sides. So that's another advantage of a CBCT, is that you're able to see exactly, you don't get any of that superimposition of images, and you can see exactly where certain structures are. Okay, also, you have the ability to save and easily transport images with the CBCT. Some disadvantages are that motion artifacts can occur if a patient moves during the imaging procedure, and is one of the most common reasons for image degradation. Also, the size of the FOV, if it's small, remember the FOV is the field of vision. If it's small, findings or pathology in other regions of the oral and maxillofacial area may be missed. So the FOV should include not only the region of interest, but also anatomic features related to the region of interest. For example, if a patient presents with pain in the maxillary molar tooth, to appropriately diagnose this condition, the FOV should include the maxillary posterior teeth, the temporomandibular joint, or the TMJ joint, and the auditory complex and the paranasal sinuses. Just because if we have a whole view, or our field of view includes all of these structures, we can easily see the relation between whatever pathology they see and what type of anatomical structures that it's affecting. That's it. That's all I have with this chapter. So as always, if you have any questions, feel free to email me, or if you're not sure, we can talk in class. All right. Thanks for listening. We'll talk next time.